The last video, I explained why stairs hurt your knee. Today, I am going to give you something practical. One exercise. The single most important movement for protecting and preserving a painful knee. No equipment, no gym membership. You can do it sitting in a chair. It will not cure arthritis, but it will change how much force lands on the damaged part of your knee. And that changes the pain. I am Dr. A.K. Venkatachalam. I have spent 4 decades treating knees like yours. And before I show you the exercise, let me say something important. You cannot inject your way out of weak muscles. Let me explain why this exercise matters. The quadriceps is the group of muscles running along the front of your thigh. These muscles straighten the knee, but more importantly, they control how the kneecap tracks in its groove. When the quadriceps is strong, the kneecap stays properly aligned. Load distributes more evenly across the joint. When the quadriceps is weak and the knee arthritis, it almost always is because pain inhibits the muscle. Load concentrates in one area of the joint, and that is where cartilage fails. A weak quadriceps accelerates cartilage damage. A strong quadriceps helps protect what remains. This is a seated knee extension exercise, often confused with a straight leg raise, which is usually done lying down. Sit in a firm chair, back straight, both feet on the floor. Tighten the muscles on the front of one thigh. You should feel the muscle firm up above the knee. You may even see the kneecap pull slightly upward. Now, slowly straighten the knee. Do not lift the thigh off the chair. Hold for 3 seconds at the top. Then lower the leg slowly. Do not let it drop. The lowering phase is as important as the lifting phase. That is 1 repetition. Start with 10 repetitions, twice a day. Alternate both legs. You may feel muscle fatigue in the thigh. That is expected. You should not feel pain inside the knee joint itself. If you do, reduce the range of movement or stop and speak to a clinician. The goal is to fatigue the thigh muscle, not to stress the knee joint. Most patients notice a difference within 2 to 4 weeks of consistent practice. Not because the cartilage is healed, but because the load distribution has changed. Stairs become slightly easier, pain during specific movements reduces, the knee feels more stable. For some patients, this is enough. The pain becomes manageable with consistent muscle maintenance. For others, particularly for those with grade 3 or grade 4 arthritis or significant structural damage, the exercise is a necessary foundation, but not the complete answer. Muscle strength is the floor, not the ceiling of knee rehabilitation. If you have been doing this exercise consistently for 6 to 8 weeks and the pain has not changed, the problem is probably not primarily muscular. It may be structural, cartilage loss, bone marrow lesions, or synovial inflammation that exercise alone cannot resolve. Or it may be metabolic, a joint chemistry problem driving inflammation faster than muscle strength can compensate for. In those patients, I look at 4 blood markers to understand what the joint environment is doing beneath the surface. That is a separate conversation and a separate video in this series. 1 exercise, 10 repetitions, twice a day, starting today. No equipment, no cost, and if done correctly, no damage to the joint. One of the most underused tools in knee rehabilitation. You cannot inject your knee out of weak muscles. Start here. If this video was useful, share it with someone who has been told to rest their knee and wait. Resting a painful knee without strengthening it makes the muscle weaker and the problem worse. I will see you in the next video. I am Dr. A.K. Venkatachalam from the Madras Joint Rejuvenation Center.